Welcome to section 1 of our chapter on immunodeficiencies. In this section, we'll be discussing X-linked agammaglobulinemia, which is also known as Bruton agammaglobulinemia. Let's get started. This scene will take place inside of a gun store. We can see a customer enjoying a magazine about all things guns. If we zoom up on him, we can see that the title of the magazine is Brute Force. This sounds like a title that's related to the military, so it should make you think about guns, and this fits in nicely with the gun store theme. In any case, the word brute in brute force sounds like Bruton, and is here to help you remember that this image is all about Bruton agammaglobulinemia. If we zoom out, notice that there is a Christmas tree in the store. It must be around that time of year. However, this tree is a bit odd because rather than a star on the top, there is an X. And the X here should help you remember that this is an X-linked recessive disorder. Now we can see the boys' bathroom with a guy about to open the door. This is to help you remember that Bruton agammaglobulinemia is more common in boys. Hopefully this makes sense to you. After all, this is an X-linked recessive disorder, meaning women must inherit 2 X chromosomes with the genetic defect, whereas men must only inherit 1. Genetics can sometimes be confusing, so if you need a refresher on this topic, I'd recommend watching section 7 of genetics in biochemistry. Everything was going just fine in the store, but now we can see some pretty serious drama going on. Notice that one customer is shoving another customer into a rack of knives. We can see that the rack says big, thick knives, and this should make you think of the gene Bruton tyrosine kinase, or BTK. So big, thick knives for BTK gene. The fact that the rack is getting destroyed should help you remember that in this disorder, there is a defect in the BTK gene. The reason they're fighting in the first place is because the guy in the red jacket came into the gun store with a bow, and the guy in the blue jacket is a die-hard guns advocate. So these two started arguing over bows versus guns, and the debate became pretty fierce. Now the blue jacket guy is pushing the other guy into a rack of big thick knives, and we can see that some of the knives are falling off of the rack and breaking the bow, as well as some of the arrows. The bows are symbol for B cells, so the fact that it's broken should help you remember that B cell maturation is absent. It's pretty logical then that the concentration of B cells in the blood is also absent. Finally, the arrows are a symbol for immunoglobulins, and the fact that they're broken should help you remember that immunoglobulins of all classes are low. All right, now let's turn our attention to this Sheldon's hot dog stand. As you can see, this guy is a pretty shady dude. He's taking dirty used hot dogs out of the trash and putting them on his little electric cooker. Now you can see little bits of hair and gunk on the hot dogs. This kind of resembles bacteria with a bacilli shape and fimbriae extending away from the bacterial capsule. Also, the sac is our symbol for a polysaccharide capsule, or encapsulated bacteria. So putting these two ideas together should help you remember that patients with this disorder have recurrent encapsulated bacterial infections. This should make sense to you. If B cells are absent, then immunoglobulins will be decreased, which means that the ability to opsonize encapsulated bacteria will also be decreased. So these patients will have recurrent encapsulated bacterial infections. In addition to dirty hot dogs, notice that this guy also sells intestines. And this is here to help you remember enteroviral infections, because these viruses infect the intestines. So patients with Bruton agammaglobulinemia have recurrent enteroviral infections. Now you can see that we've added a 6-pack on this guy's hot dog stand and some unattended babies that are climbing up and reaching for the drinks. The 6-pack, along with the babies, are here to help you remember that babies are typically asymptomatic at birth and begin to develop recurrent infections after about 6 months of age. Next, notice that we've added a Jeep on sale to the image. This vehicle seems to go well with the gun store because these type of people often like to be outdoors hunting and whatnot. So the Jeep is a good fit for a gun fanatic who will be off-roading. In any case, notice that 2 unattended hooligans found some of the hot dog guy's hot dog skewer sticks and are popping the Jeep's tires. Now we can see the Jeep's frame smashing against the ground as the air rapidly leaves the tire. Anyway, the word Jeep sounds like G and should help you remember IgG. The fact that the Jeep is being destroyed should help you remember low IgG. So this is here to help you remember that infections are more likely when maternal IgG wanes, and this occurs around 6 months. Now we've added another unattended kid who appears to be eating a fishing net. He must have found this in the fish hunting supplies area, and now he's mindlessly chewing it up. Talk about some customers from hell, right? Anyway, the beaded net is our symbol for the lymphatic system, and the fact that it's being destroyed should help you remember that patients with this disorder have absent or scanty lymph nodes and tonsils. This is because the germinal centers and primary follicles, which are the areas where B cells reside, are absent. Finally, notice that we've shown an old woman who just came into the store and appears very upset. She hates hunting, and she's mad that her husband comes to this place to look at guns and read the magazines. We can see her pointing at him and telling him to put down the magazine and come home. She was so upset that she also smashed this live dog show sign as she came barging into the store. Looks like the store was setting up a hunting dog show in an attempt to sell off some hunting dogs as well. Anyway, recall from our microbiology videos that the syringe-shaped live show sign is our symbol for a live vaccine. So the fact that it's getting destroyed should help you remember that live vaccines are contraindicated in patients with Bruton A-gamma globulinemia. All right, that should be everything you need to know about Bruton A-gamma globulinemia.